When I think of hospice health, I think of pain management, grief counseling, medication, and help in those areas. And they certainly do all that, but they're expanding their services. This is good news. With me now is Tawanda Owsley. You're the Vice President of Development.
Yes.
Welcome, Tawanda.
Thank you. Thank you for having me.
Thank you so much for coming on. Okay, expansion of services. Let's talk about that. Obviously, during this time, it is needed. So tell us a little bit about this expansion of service and the thought process that went into deciding to do so.
Absolutely. So we are in the middle of a $24 million campaign called People of Compassion. I think many people think of our services in a compassionate way, and we've been delivering compassionate care for a very long time, over 41 years. Our most compassionate people are our caregivers, and oftentimes we've not talked about serious illness in the past. We've not talked about death often in the past, and I think COVID has opened up that conversation to be more familiar with folks and more constant now. So what we want to do is make sure that everyone has the ability to have a good death. We want to make sure that everyone has the ability to take care of their seriously ill family members, and we want to do that in all 41 counties that we serve. So we're raising money with our People of Compassion campaign, $24 million, to make sure that services are there for everyone, regardless of their ability to pay.
Okay, so these expansion projects that you have, how will they help what initiatives? Obviously these projects are to help out certain initiatives. Can you detail that a little bit, Tawanda?
So right now we are one of the only few people that have a pediatric care for palliative and seriously ill children. So it's called Courageous Kids, so we'll be able to expand those services. Grief counseling, as you mentioned before, we're all grieving right now. We're all grieving a lot of things. We're grieving death of lost and loved ones that we may not have been able to grieve that death in a normal way. We're going to expand our grief counseling services that are here in the Louisville area. But more than anything, we're going to be able to take care of those seriously ill family members with our palliative care services. Oftentimes people remember us because of our hospice care, which is end-of-life care. But many people don't know that we're there for folks that have dementia, that have pulmonary disease, that have heart disease, and they may not be at end of life, but it may be a serious condition that family members need help with. So we want to be there for family members in all areas.
That was a term I was not familiar with, palliative care.
Yes.
So tell me a little bit about palliative care. In other words, you articulated that very well. A lot of us associate hospice with a loved one passing.
Yes.
And I think that's natural because obviously that's something that's very, it's in your brain, you remember it, and how much you were, I can't tell you how many times I thought hospice is the same as angels. They're God-sent, and that's true. But palliative care, what does that mean? So
hospice care is end of life, the last 6 months of life, and that's what many people know us as. Palliative care is if you have someone that has dementia that we don't know when that end of life may be there, but we want to be there for them. If you have someone with a chronic or serious pulmonary disease, lung disease, we want to be there with them. We want to help them get through that. If you have someone with COPD that's suffering really at a high level that your family can't support, we want to be there to help them with that. So that's where that palliative care kind of comes in.
This community, obviously, well, every community throughout the country is hurting due to this pandemic.
Yeah.
And Louisville may be more challenged because we take great pride in being, as you said, a compassionate city. Mm-hmm. So talk a little bit about that, the importance that now is the time to expand these services, maybe more appropriate than ever, right, Tawanda?
Absolutely. We know that more and more people are aging every day, and I think our senses and what we know is that those folks that are 65 and older, many of them have chronic illnesses, so they're living longer, but they're aging at a fast rate. We had a whole group of baby boomers that are aging pretty rapidly, so we want to be there for those families. And then also to know that we don't just service Louisville, we serve 41 counties. We go all the way to Indiana, all the way down to Bowling Green. So we're in 41 counties in this service area, in your viewership area, so we're not just in Louisville, but we want to be there more than ever. And what we want and what we need right now is for folks to donate. So we need donations. We're at over $22 million toward a $24 million goal. So if you ever think about doing a donation right now and you think about end of year giving, we want you to consider us because we want to be there for your family. All
right, so folks can help you. They go to the website. Is that the way to give?
Yes, hospicehealth.org is how you make a donation, and just help us get to this $24 million goal. Like I said, we are able to take care of families regardless of their ability to pay, and we want to be able to continue to do that, and how we're able to do that is through the donations and the generosity and the compassionate people in our community. We've had over $22 million raised, and that's because of people in your area and in this area that are continuing to give to us.
Tawanda, I'm always curious about folks like you. Not only do I not have the skill set that you have to do what you do, but it is you handle tough situations. You're involved, directly with life and death situations, and that's in this case not an exaggeration. What attracted you to Hospice Health? Your resume is impressive. You're the VP of Development. You could work anywhere. Was there a personal story for you, Tawanda, that attracted you to them?
I think we all serve because of something that personal has happened to us. My grandmother received hospice care 10 years ago, and I cared about it. I've always been in healthcare philanthropy, but to come to Hospice Health was because of my grandmother and her experience with hospice care.
I bet you that she is very proud of you. I'm a firm believer she's watching you and loving every minute of it.
Yeah.
So for those who want to help out, again, I want to remind you, if you want to help out Hospice, perhaps you've been helped in the past by one of their services. Now they are expanding and they need your help. So you go to that website. There'll be a little, I'm assuming, something you can click on to give. And as far as people who maybe are looking for a new opportunity, I'm assuming you're hiring all the time.
We're always hiring. We're always looking for great caregivers and compassionate people that want to help serve. But please consider making an end-of-the-year donation. And there's a Donate Now button on that hospicehealth.org site.
Yeah, and grief counseling is a big part of that. I know, when my mother-in-law passed away, you guys helped us so much. And you did not lose contact. Even prior to the expansion of your services, it was like, hey, how can we help you moving forward? Because it's a process. It's tough, and you know this.
We are all grieving, and I think our community is grieving collectively, and we're going to be here, and we will always be here. So thank you.
Tawanda, thank you for what you do. Again, I really appreciate it. Tawanda Owsley, and she is the Vice President of Development. Okay, coming up here.